Blood work. It's something all of our patients have, yet we were only taught how to interpret the blood work. And that's in the case of most of us. Some of us weren't even taught that. Or what we were taught about interpretation of blood work was way too complicated that none of us were really able to implement it. Well, today's training is not about interpreting blood work. It's about what you can do from a business perspective with blood work as your tool. Now, maybe you have a niche and you want to add blood work into your services. Maybe you're a muscle tester and you want to combine blood work into your services. Maybe you don't have a niche and you want to use mine, aka blood work, as your niche, as your specialty to moving into that business direction that you really want to go. Well, today I'm going to present to you not one, but four different opportunities you can create using labs your patients already have. Once again, this is not about interpreting blood work. This is about how can you use the blood work as a business goldmine. And that's really what it is. I'm Dr. Kylie. I was a chiropractor. I am a chiropractor by degree, but in 2019, I decided to go virtual so I could spend more time with my family. In fact, in 2019, I was sick with pregnancy and I literally physically could not make it to my office, which was just 10 minutes away. So I knew that if I was going to do anything in this industry that I love, this alternative medicine world that we all love, I needed to do something else besides brick and mortar. So in 2 weeks, I pulled the trigger and I went virtual. And that was a Halloween in 2019. I remember that was the last weekend I was in my office. And little did I know what was coming in 2020. Well, what we've learned over the last 5 years has really taught us all that we need to have additional income streams. We need to have ways to attract clients with ease. We need to have ways to multiply our expertise doing what we love, impacting many at a time. Now, if any of this resonates with you, this is a training for you. Most of these, in fact, all four of these programs I'm going to teach you, though, can be implemented as early as tomorrow, as early as today. This is only a 15-minute training, so it can be as early as today. These services are things that I not only implemented, but others have implemented very successfully too. And when I say others, I'm talking over 350 practitioners have implemented these, so you can too. All right, let's get started. Okay, we have the Blood Work Goldmine Workbook. This is going to help you pick which of the four offers you want to create and move forward with tomorrow. Or if you want to move forward with all four of them at some point, great. You have this workbook here as a reference to rely back and forth on, okay? So like I said, over 350 practitioners have implemented one or more of these offers over the last only 4 years. When I shifted in 2019 and then I took off in 2020, I had a lot of practitioners and clinicians and colleagues asking me, how did I do what I did? How do I do what I do? Because it's a requirement post 2020. So these were practitioners with all different types of circumstances. Some of them were in brick and mortar and wanting to go virtual. Some of them were wanting to just add this service into their brick and mortar practice. So whether you're wanting to expand your brick and mortar offices or offers, or you want to go virtual or do a hybrid of both, this is a clinical tool that you can do so. So whether you want to stay in the brick and mortar, you want to combine a virtual component with your brick and mortar, or you want to pivot completely to the virtual space, or if you're in the virtual space and you want to thrive, well, this could be a very clinical tool, a very simple clinical tool to incorporate. Okay. How powerful is this? Well, the first service I'm going to talk to you about is what we call, or what we were trained on as the report of findings. My report of findings and my initial processes were all in the same. I'm going to explain that to you in a minute. So over the one weekend, I was on a podcast and it aired. And when that somebody else's podcast, mind you, when it aired, Over the weekend, I had 21 people pay me for a $495 lab consultation. Now, granted, I was out playing with my kids when this was happening. I showed up at the office Monday morning and I'm like, oh, 21 people want my report of findings. That's freaking awesome. What a great problem to have, but it was a problem, which is how I created another offer, and I'll get to that in a minute. The first offer that I'm going to teach you, which is this $495 offer that I charge. Now, I'll walk you through what the range of price tags are as well. But this wasn't just me that exploded over the weekend. Danny, one of the practitioners who did this blood work interpretation stuff and implemented it very quickly, she joined somebody else's YouTube channel. Now, as a nutritionist, she needed somebody or some clinical tool that separated herself from other nutritionists. So I get this email, as you can see, and it says, Kylie, I need help as of yesterday. Can you help me find a VA? Okay, so I connected her with a virtual assistant. Within 24 hours, we had them connected and they were working together. Why? Because when this YouTube video went live, she had over 140 new patients overnight, all from this simple lab review. This is powerful, and you can implement this tomorrow. Okay. Before we get into the service, take a quick minute here. I'm not going to spend too much time on this, but let's assess where you're at. Let's assess where your current model is. How many number of active clients do you have? Because these clients that you currently have, you can offer this exact same service to. So there's no more additional marketing. There's no going out and retrieving new clients, even though this is a very easy way to attract new clients. You can use the current clients that you already have. So take an assessment of where you're at. Average number of new clients per month. And the thing about this, how many of your clients have blood work and they complain to you about the results? You know, doctor told me my labs are normal again. Great, this is perfect. Okay, go through this. And then here's a little sneak peek of what we're going to cover over the next 10 minutes. Okay, service offer number one, the report of findings. This is the number one offer people implement very easily, very quickly. It's your new client onboarding process. Okay, this includes the initial intake with the report of findings all in one. So it's a paid service where clients receive expert analysis of their blood work with clear answers and recommendations, positioning them for the right healing program. This is step number one. This was my $495 offer. I would read their blood work and I would then say, okay, the next best program for you is this. Now, at that time, I charged $495 for this in 2020. I was hosting these in-person conferences and when I say conference, in-person workshops in conference rooms of hotels in 2018 and 2019. And my offer then was $197, and I would then dock it down to $149. So there's a price range for this. You do what's comfortable and probably even presses your comfort zone a little bit. Okay. So that's service offer number one. It's where you're gaining clients. I was on with a phone call with a client the other day, and I was helping her manipulate an email in a way that was going to get a yes from her patient. Now, her patient signed up for her 249 lab review, and then she got her lab review and her program afterwards, and she immediately wanted her daughter and her son to do it. One patient immediately turned into three because of the family member referral. And then we ended up creating a family package for her. So a 249 offer turned into a 1650 invoice that was then sent and paid quite quickly. So are you going to offer this in your practice? Start asking your current patients about their blood work and let them know that you can read it for them in a way that's unique and different than their doctor so they can get real answers. And it's, $199 or $249 or $495, whatever you feel is right for you at your experience. Number two, this one is one of my favorites to do right now because it's scalable and it's very easy to implement. It also is very easy for you to fulfill. Once you have it created and done, it's done. All right. This is the DIY protocol or the do it yourself protocol. Now, I've read thousands of labs, and I can't tell you how many times I've read a lab and I've created a personalized plan. And then I read the next 5 labs and think, wait a second, that plan I created for that person could work for the next 5 people based upon these labs that I've seen. So it's a foundational program for a reason. When you see these labs and you start seeing them in quantities, you realize that people need some of the same foundational components to heal. So that's where your DIY offer comes in. It could be a 30-day foundational program. It could be a 60-day foundational program. It could be a 90-day foundational program, whatever feels right for you. The way that you go about this with the labs is, okay, so say you want to target fibromyalgia. And the fibromyalgia marker that you can correlate with is a neutrophil count. Now, the way I interpret blood work and the way I train practitioners to interpret blood work is that the neutrophil marker, if it's over 60%, we're battling bacterial infections, a low-grade bacterial infection that will never come up positive on a regular test because it's not strong enough. Well, that marker, you can then create say it's a 90-day protocol to help the immune system become strong and fight off this low-grade bacterial infection that affects the 3 components of fibromyalgia: sleep, pain, and fatigue. So how do you know if this DIY protocol or this DIY program is going to work for somebody? Well, they go into their neutrophil marker and they see, oh, I have this, it's 68%, and I have these 3 symptoms. That's going to work for me. Great. The same concept can happen for an ALT or AST, liver markers. A 30-day detox. How do you know if you need it? Well, if your ALT or AST marker inside your blood work is over 15, that's what you need. My favorite is a vitamin D challenge. If your vitamin D is less than 60, you need this challenge. Okay, that's how the DIY protocols are created based upon lab markers. I even throw in a script on how you can offer this if you need a way to talk about it. Okay, now one quick success story here. Wyoming chiropractor's a $1,500 per phase program. Now he wants to do thyroid and diabetes with his current clients. So he's created a 3-phase, 90-day each phase program where it's $1,500 per phase. His profit margins on that are over 60%. Now, this is the foundational healing protocol that he has created, and he's then implementing that on a larger scale with his current clients. So he's taking his decompression clients and he's turning them into full functional medicine clients. They're getting better results because they're combining the functional medicine, the inside work with the structural work, and they're loving it. All he does is sell these 90-day kits, phase 1, and then when they're done with that, they go through phase 2, and then when they're done with that, they do phase 3 as a maintenance. So he's taking one client, turning it into a $4,500 maintenance plan, so lifetime value of the customer is elevated in addition to his chiropractic stuff. Now, his current clients are using that. He's going to start going back to his old clients, offer him the same thing. So he's activating new clients. Number 3, the third offer is along similar lines. This is how group programs are also created. And I know you might be a fan of group programs and you might be like, no, that doesn't work. Okay. Well, it can, especially when you're correlating it with the blood work and the markers. So you could create a group program on autoimmune and call it autoimmune recovery. And you can get into the blood work and see if they have the 1-to-1 ratio. That 1-to-1 ratio is the ratio between their neutrophil count and their lymphocyte marker. You can create a group program based upon that marker and those autoimmune symptoms, knowing that they're going to need these foundational components and they'll get results. What about hormone balancing? Well, maybe you want to focus on blood glucose and A1C. Digestive health, you can utilize that neutrophil count. Energy and fatigue can be correlated to sodium and potassium markers, which are related to adrenal fatigue, or you can do the viral route with lymphocytes. Maybe you want to do an anti-inflammation or an inflammation reduction program, and you can look at their HSCRP or utilize their lipid panel. So that's how you correlate these programs with lab markers. Well, once again, we've been told how to interpret these, but we've never been taught how to use them from a business perspective and how to create different types of service offers with markers as your foundational core. Okay, so back to my 21 patient success story over the weekend, I realized I couldn't keep doing this one-to-one stuff. So I created a 6-week program where I would help individuals identify their own lab markers. So I was teaching them how to read their own labs. And then based upon what they learned in their labs, I would upgrade them into a 90-day group program. So pretty cool what you can do when you open up your mind to these new types of offers. And last but not least, the offer that we are all very customized and familiar with is that personalized one-to-one program. I was working with a client yesterday, and she wanted to continue with her one-on-one support. That's what she loves. And I said, okay, great, let's do it. But she was doing a la carte stuff. And rather than doing a la carte items and not making any money, we crafted it into a powerful 6-month personalized program where she has like a foundational component and a VIP high touch care. So there's 2 options in her personalized one-on-one program for 6 months, and it's based upon the labs. And I think she's adding in the Zyto scan and some muscle testing as well. So that one-on-one offer we're all very familiar with. You can incorporate blood work and simplify your clinical processes so that no matter what somebody presents to you with inside an office, whether it be a diagnosis, whether it be a list of symptoms, you have an exact step-by-step plan to take them through. And maybe they can't do your $7,500 one-on-one program, but they can do a $1,500 foundational program that's DIY and get them started. Okay. Whew, that was a lot, and we conquered in such a short time. If this is resonating with you, and if you would love to incorporate blood work in your office and maybe even create some of these other programs at a scalable market, like I said, I am Dr. Kylie. I am the CEO of Foundational Medicine Institute, and we love to help practitioners expand their businesses, especially if they're looking to go into that virtual space, whether it be a hybrid model or a completely virtual model. We are specialists in this. And if you need a tool to take you there, well, blood work can be that tool. The way to find out and to learn more is to book a call with my favorite team member. The link is foundationalmedinstitute.com/chat. And give me a few more minutes here, because if you go through this workbook some more, it will walk you through this launching your first offer, and then walk you through, okay, if I do a report of findings for $495 and I get 3 of these clients, that's an extra almost $1,500. Okay. One last success story. Nicole was exhausted from one-to-one care. She did not want to ever accept another client unless they paid her $10,000 up front. She was burnt out, which I see oftentimes when we only do one-on-one care. So I helped her create 2 different options, a DIY and a group program. So she hosted one workshop, invited her current clients from it, her past clients, invited them to invite some of their friends. And before we knew it, she had $20,000 in cash. Not only did she feel relieved by the cash inflow, but she was willing to serve these individuals again. Like I said, she was fried. Did not want to do another one-on-one patient, but knew, we still got to have money coming in. That's what pays the bills. That's what helps us do these vacations and things that we want to do and spend time with our family. So if the DIY, the group program has been haunting you, let it haunt you no more. That's how we implement it into our practices successfully. If you would love some more support doing this, I'd be happy to help. Go schedule your call. It's free at foundationalmedinstitute.com/chat. And I'll see you on the inside.